So again, welcome. This is our conversation today about ConnectATX, the Mission Capital Membership Meetup, and we're excited that everyone is here today. Meredith, I'll let you all take it over.
All right, well, good afternoon. Oh, it's actually still good morning. I'm sorry, maybe if you're on Eastern time. I'm Jeff Carey. I'm the director of our ConnectATX program with the United Way for Greater Austin, and we're really excited to have the opportunity to connect with you all today so that we can talk more about our partnership with Aunt Bertha and the tool that we have created in partnership with them in this larger vision that we'll talk about called Model Community. With that said, I know we want to go through kind of the agenda here, which is going to be just going through our background, our introductions, and then talking more about ConnectATX and 2-on-1, because that's one of the biggest questions that come up during these conversations. And then really having these the breakout group to really talk about community needs, go deeper into the tools, and actually show a demo of how to use the tools, and then just talk about next steps and questions. So like I said, I'm Jeff Carey. I'm the director of ConnectATX, and I'm here along with some of my other coworkers who I'll let them introduce themselves now.
Perfect. I don't mind jumping in. Good morning, everyone. My name is Emil McPeters. I work with Jeff at the United Way. I'm the Community Integration Manager, helping to promote ConnectATX, so to speak. Good morning, everyone.
Good morning, everybody. This is Marcela Ramirez. I'm the Community Integration Coordinator. I help with updating the programs on ConnectATX.
All right. Well, thank you, everyone. And Meredith, were you gonna introduce yourself? Or are you gonna wait till it's your turn?
I was gonna wait till it's my turn, but hi, everybody. My name is Meredith Stefos Norris. I'm here on behalf of the Aunt Bertha team, and I'll talk a little bit later about how our partnership helps make all of this happen.
Awesome. Yeah, thanks, Meredith. We really appreciate Aunt Bertha's partnership in all of this. They've just been fantastic as we develop this tool out for the community. So thank you for being here, Meredith. I wanted to talk more about just ConnectATX and really talk about the larger vision of what we're doing here and where ConnectATX fits in this and where you all fit in this. And so we've got a couple slides to really just talk about that larger vision, which once again is called Model Community. And this is this vision of that the client is at the center of everything, and that there is really this no wrong door. The door can be 2-on-1. It could be our ConnectATX phone line. It could be their clinic. It could be their school. It could be at a workforce organization. It can be kind of anywhere. And that's the idea, is that we build these partnerships with organizations like yourself, and to build these basically these front doors for clients to work with. And in cooperation and coordination with everyone, what we're trying to do also is, well, how do we build this system, this network, and kind of track client information? And so we're going to go more into that. But what we're doing is we've developed tools in partnership with Aunt Bertha we use a social determinants of health assessment, which is based on the PREPARE model, and it's a variation of the SDOH that People's Community Clinic uses. We have service navigation, and we'll talk a little bit more about that. But right now, through ConnectATX, we have a phone line, we have chat, and we'll have text available in 2021. And then Emil and Meredith will talk more about just closing the loop. With 2-on-1, if many of you have used the platform before, you know that while it's a great resource for information, it's an anonymous service. And when the client hangs up, the relationship kind of ends, and we don't necessarily know what happens. And we know that there are people that are falling through the cracks, and we have, with this tool, we are building relationships with organizations to close the loop with our clients and with your clients, so that we can know, did they get help or not? And if they didn't, we still have the tools to ensure that they're getting directed to an organization that can provide the help they need. So really to talk more about like where does everyone fit in this, and then also our partnerships, is that, as I said, the client is first. And then they're working with organizations like yourself. And then organizations are using ConnectATX as the tool in order to find these resources. And then also, and Emil and Meredith will talk more about the tools that are available within ConnectATX, but really to provide that support system for your clients to ensure that they are getting the help that they deserve. And then lastly, this is all part within Model Community. And Model Community is just several different partnerships, starting with the funding of the Michael and Susan Dell Foundation, and then with the technology side powered by Aunt Bertha, and then partnering with clinics like People's Community Clinic, Lone Star Circle of Care, on the data side with Dell Med. And then just recently, we've entered into a relationship, an agreement with Austin Independent School District. And we see that growing within the workforce side, within the further within the education side. And so it's really, really exciting that we're building this infrastructure to provide this support system for our community. But we can't go any further into this until we really talk about how is this different from 211. And I touched on it a little bit, but we really see this tool as really complementary to 211. 211 has a phone line. Because of COVID, 211 just recently got chat. Our platform will be available through phone line. We have chat currently, and like I said, text in 2021. The navigation is similar as far as staffing. All of our staff are highly trained, go through rigorous training process. Now with 211, we can take thousands of calls per week because it's a statewide, statewide program. For ours, right now we have 2.5 staff, and because we're using an SDOH, our calls typically range about 10 to 15 minutes if the client agrees to go through that process. Right now, we're just focused on Travis County. In 2021, we plan to expand our reach to Hayes and Williamson County. We have Marcella on our side, on our ConnectATX team, who's responsible for providing support to ensure the resource information on ConnectATX is accurate and up to date. And we have a similar team on our 211 side. We really leverage our relationship building that we have through 211. We've been a 211 partner for over 20 years at the United Way and have built so many amazing relationships and community partnerships. And we've really been able to use those partnerships in order to start building, building the infrastructure of ConnectATX. And so, but this is part of like there's a shift. 211 works. If someone is in an eviction and they need rent right now, 211 is probably the go-to resource. For ConnectATX, we're trying to make systemic change. And also with 211, it's confidential. Like I said, everything is anonymous. And so a caller could call and tell their story, and then they call back and they have to relive that trauma. With ConnectATX, we are tracking their information with their consent. That's one thing that's really, really important, is that the client has full control over giving consent to share their information with organizations. But we're really building this, longitudinal record for them. And then finally, Emil and Meredith will go more into this, but we're building closed loop capability, which 211 doesn't have. And we recognize that there's a big need for it in our community. And we've been in so many conversations over the years about, hey, we need this kind of centralized system in which we're tracking people so they're not falling through the cracks. And so that's what we're building through the tools provided by Aunt Bertha. And so we're going to talk a lot more. This screen here, you're probably going to see a few times today. But it really, we need all levels of partnerships. And so Meredith and Emil will talk more about this, but this is just to kind of get you familiar with this slide, because we're going to be asking you, like, where are you at, or where do you want to be? Like, do you want to be an organization that's just searching for resources for yourself or for someone else? Do you want to be engaged to where you're making edits to your program cards and ensuring that all your information is up to date? so those who may be engaging with that information know that that it is accurate and up to date? Do you want to partner and actually be part of our closed loop referral system? And then finally, do you want to be a champion to kind of just spread the word of model community? So we need all types. And so we're really excited to be here talking with you all about ConnectATX and how it may be able to help our community.
Thanks so much, Jeff. I really just want to echo some of the things that Jeff just shared about the Model Community Project, because that word systemic change is so integral to the work we're trying to do right now. And one reason why we were so excited to be able to partner with Mission Capital to meet with y'all today and to be able to use this time, not just to think about, individual tools or tricks or a platform, but what does it really take to make sure that every single person in the greater Austin community, when they reach out for help, when they are in a time of need, that they can get the help they need? And how do we build that huge safety net around our individuals that put those individuals, those seekers at the center, like we saw in the model community graphic a few slides ago? And so we're really thankful to have y'all here as partners in whatever form that takes. So we are going to use this quadrant, as Jeff said, many times throughout the session today. And it's our way of offering you different lanes or different opportunities for how you can plug into this work. Because we need people playing all four roles, and all of them are so important. And so as we think about the different roles you can play, I want to just once again run through them. Maybe you see, oh, when I think about connecting people to care, I want to be that helper making those connections. Maybe you're thinking, I've got a service, I want to make sure people know about it. Or I have these relationships, I already work really closely with United Way, or I work closely with 211. I want to make sure that that communication is happening, that everybody knows whether or not that individual got help. Or maybe you're saying, this is super exciting. There are 10 other people who should be in this room who are not here right now. All of these are great answers. We need people playing all four roles. And I actually want to kick us off with some technology, a poll to get a sense of where you see yourself right now. You may change your mind over the course of the session. Different things may appeal to you. There's no wrong answer. You can answer multiple things. But knowing where we have a lot of interest right now can help us tailor the rest of the session to make sure we really meet this particular audience. So with that, some of y'all may be familiar with Mentimeter. And if you are not, it is a polling site. You can use this from your phone. You can do this from your computer. If you've got your phone out, you can scan that QR code in the corner. I'm also going to put up a new slide that gives some more directions at the top. This is a poll where you're able to fill out where you see yourself. And so there's another link at the top, menti.com, and a code. I will also put a link in the chat. But right now, let's all take a minute, and whether on your phone or your computer, go to menti.com and put in the code, or head to the link that I'm going to drop in the chat that will let us all vote on where we see ourselves today. Again, no wrong answer, and you can put in as many answers as you want. You can be interested in everything. We'll give it another few seconds as folks are continuing to drop those in, and we'll come back to these results in just a minute to examine, our trends that we're seeing and think about where this particular group is. So keep voting, it's still live. I'm just gonna head back to my slides and do some talking while folks are finishing up their votes. We've mentioned Aunt Bertha a few times. We are a homegrown Austin company. We were founded about 10 years ago as a public benefit corporation. Some of y'all may have worked with us before, or you may have heard of some of our sister sites like findhelp.org or YSM if you work with Austin ISD, Williamson County Community Resources. We work to power platforms that make it easy for individuals and programs to connect. So when there is a moment of need, when there is a service that's needed, how do we make this easy as possible?
Meredith, you're cutting out just a little bit.
Help make that process easier, and we know that there's your internet is unstable message, so hopefully that will go away soon.
I think you're coming back. We just, oh, there you are. I think if you can just repeat that last section.
Okay, great. Years ago, working to connect people in need and the programs that serve them with dignity and ease. And we are based in Austin, homegrown in Austin, and our company is based here. You may have worked with us before through AuntBertha.com or one of our sister sites, findhelp.org, YSM, if you're an AISD partner, Williamson County Community Resources, or you may be familiar with ConnectATX. We are using technology and our team to help build a massive directory of free and reduced cost resources that make it easy to find and connect to resources when you need them. This is all powered by real people, and our team vets and approves every program that goes on the site. We were founded to, exactly as I said, connect all people in need and the programs that serve them with dignity and ease, wanting to put the power in the hands of the people that are searching for help and the people that are offering that help to connect and respond to each other. And we were founded because of a problem that I know everyone in this virtual room is very familiar with. And that is that it is simply too hard to navigate the system. Whether it is searching for programs that turn out to be in other locations or not available to people who fit your description, whatever the different barriers and red tape are, it can be confusing, complicated, and just plain difficult to get the help you need when you are in a time of crisis. And that is really where we want to open up the discussion today, because we know that it is too hard. We know that ConnectATX and Model Community are parts of the solution, and we know that y'all are the ones making the connections, talking to your clients, doing the work every day. And so what we want to do right now is actually open up some space to talk about this. It is too hard, but why? What challenges are you facing? What challenges are your clients facing? How has COVID impacted that? And so Chelsea is going to help us put folks into some breakout rooms.
Let's bring up the screen share. I just wanted to say we went back to recording, so we're starting again to capture this so you can refer back to it as well. Feel free to turn off your cameras if you feel more comfortable that way, whatever you need to do.
You ready for me to start sharing? All right. So, as we continue to have this conversation, and first of all, good morning to everybody again. But as we continue to have this conversation, Jeff and Meredith pretty much, told us exactly what ConnectATX is in terms of this model community effort. But ConnectATX is the community information exchange tool that has a free online resources or free resources that are online for reduced costs, like medical care, food, housing, and etc. Also, ConnectATX has, its federal benefits on there that you can look over, COVID-19 resources, and recently added a holiday section so folks can search for resources that way as well. And so, as we're talking about ConnectATX, folks are probably asking themselves, who uses this platform? And so there are, in these groups, we see that there is a seeker or an individual, maybe a father who's living in Austin, who's searching for resources up late one night. He's looking on his own. He's an individual seeker. or maybe he's being assisted by somebody, a friend, a teacher, or a social worker. And maybe that social worker, that friend, or that teacher works in one of the community-based organizations. And those three entities, they make or they comprise the network that we are supporting here, and that the network that is supported by Ambirth and ConnectATX. And so here's that screen again. We're looking at, folks that are searching, that are engaged, that are partners and champions. And as Jeff and Meredith mentioned, there's no wrong role to perform, but there is an opportunity to really think about those things and what it is, what role folks are playing in the community. And so again, can just continue to ask yourselves, which role you're playing. And as we look at, the searching role, I'm going to try to find an opportunity to demo what searching would look like in terms of navigating the site. And so what we're looking for, some of the objectives that we're looking for is we're looking to find programs. We're looking to log into our favorites folder, and we're going to come up on this thing called referrals and then people I'm helping. And so this gives us an opportunity to demo the site. Let me pull up a version of the site. Can everyone see the version of the site that I'm sharing right now? Okay. And so.
No, we can. We still see your slide deck.
We still see the slide deck? Okay, hold on. Let me stop sharing. Let me go back to sharing. Let me see that. And does that work? Perfect. All right. And so here is the ConnectATX site. And if we scroll down on the site, we see that there is the survey, or as Jeff mentioned, the SDOH survey, or social determinants of health. And then there is the chat function, and then an opportunity to actually call some of the navigators that work for ConnectATX. We see down here the categories that are the list of curated resources that the site currently offers. Food is a huge thing right now, so I like to, if you go over one of the tabs, you can log in and you can actually hit the food pantries button. Pulling up. And so at the top here, you can see some best practices, which is either to sign up or to log in. But when you hit the buttons or the food pantry button and go in, you actually see how the site is started. And that is through the zip code search. And so I'm going to type in a zip code that is in Austin. It's probably closer to me, and ask the list to filter that zip code. And some information pops up with a program card that we can see right here. Program card is for the Neighborhood Services Unit. We can see here that it has a check mark here in the corner. This check mark means that the program is claimed, and claimed programs and suggested programs are here at the bottom, and we're going to revisit these later on. But I wanted to show you this program card, which has all of the information, the operation, the services, and then the people that are being served at this particular site. Also, if you click the more information, it has more information about eligibility, when it's available, and the description of, again, another description of what services are offered. At the bottom of this tape here, you see that you see the save, share, notes, and suggest. So if I'm helping somebody and I wanted to save this program, well, first of all, I probably need to log in. So let me do that. I'm sorry. Give it a second. And then again, so now that I click the save button, it's going to ask me some additional questions, as if, do I want to create a folder? Do I want to save this resource? And I can save this resource for later use if I wanted to refer back to it, and I can find it again right underneath this saved, right underneath this place where it says saved favorites. And if I wanted to share this resource with the individual that I was helping, icon here, and you can see that there are different ways for me to share this information. I could send an email, I could send a text, I could share on Facebook. Let's imagine that I actually said, yeah, you know what, I want to call this program and make sure that this is somewhere that I would like to go or utilize their resource. And I spoke to the intake coordinator and they told me something in particular about the program, and I wanted to save it as a note for myself. I could click this note section and type in whatever the intake coordinator told me. Maybe they told me to enter into a different entrance or something like that. And I could save that here, and that I would have that information the next time that I visited this program card. And also, if I wanted to suggest something particular to the program, I could leave that message here as well. Now, next to us, we see this green button here. This green button actually says apply here. And so if I click this button, it will give me as the helper, it will give me some additional information to input here. Now, when I'm clicking this button and it's telling me this information that I need to input here, and name, address, or email address, and phone number or best point of contact, there's also a consent button here. And this consent button is for the client if they want to share that information. And then there's the next button here. And this would go as a live referral to the organization that I just clicked apply here to. And so in doing so, I'm sorry, let me get rid of that. In doing so, in clicking that button, actually, I know that I clicked the button. I get an email. That organization gets an email, and the person that's in the middle, the individual that's being helped, also gets a notification. We all get this notification, and we are all pretty much in the loop about what it is that's taking place that we're learning. If I clicked, and I'm sorry, but when you claim a program, you get access to this free suite of tools up here, which is and one of them is the My Programs tools. And so if you click that program tools, you can go over to the left side of your page, and it will bring up for you, the referral that you just sent. I sent a referral using this tool yesterday to myself for the purposes of this meeting. And as you can see, it says that, the person was referred, who was inquiring, referred on, what times, what actions. But then it also has this button here that has a status update. And this status update allows us to update what actually happened to this individual that we are trying to help. Were they eligible for our program? Were they not eligible for the program? And this is important because, in the sense of efficiency, we're trying to help this individual get exactly where they, what they need in the interest of, trying to be as that they need this, that they need this resource now. So we're trying to make sure that, we're closing the loop, and also that we're, getting this person to the correct resource that they need and following up with the community. I'm sorry. Stop being on the chat with me. I also wanted to highlight that there's this, when you receive this free suite of program tools, there's also this edit my program listings. And this is where you can interact with your program card. Let me click that again. Oh, perfect. This is where you can interact with your program card. And so I was just in the ConnectATX housing demo, and I can edit my program and the information that comes up on my program to make sure and ensure that I have the accuracy that everyone in the community knows, how accurate the information is, so that they can access my program. And so you can change your phone number here, your website, offer any program information or program details that need to be updated. And if you go back to the edit my programs listings, in the edit the hours and locations, we know that this is all a thing during the COVID area that we live in. This is where you would edit, whether or not your program is open, whether physically open, offering services at that time. If there's a change in the address or a change to the services that you're providing that day, you would do it from that button. And then there's a middle button here, this edit contact settings actually. This is the button that has the referral capability. And so this is where we start the discussion about the closed loop referral process. And so as you can see here, there are screener forms, intake schedulers, and one-step referral tools. By selecting and publishing one of these tools, you would be able to communicate with the community that, yep, I have a one-step referral tool turned on or eligibility screener turned on, and you would either be able to capture information in that way or screen for eligibility or actually have access to someone setting up an actual appointment with the scheduler tool that they would use. And this is also an opportunity, and you can use as many email addresses as you want to, who gets that information. At this one it's info@ConnectATX, or, it could be several individuals that answer these emails that are going through the referral process. I'm going to stop sharing my screen right now. And Meredith, I believe I'm handing the baton right back over to you.
You are, and I'm going to take a minute to just affirm some answers that were coming in the chat while you were talking. We had a question about the updating information. Two interpretations of that. Number one, if you work for an organization that offers a program, you can edit the information about your program. You will need to claim your program. I'm going to put a link in the chat right now that makes it easy to claim your program. I can find my, there we go. Claiming your program says, I am here, I work here, I vouch for this organization, I'm going to help keep this up to date, I'm going to help respond when people reach out for help, or I'm going to figure out the right person who will do that responding if somebody reaches out for help. I want to make sure our listing is up to date. For folks who chose that second category, engaged, you want to make sure your listing's up to date, people can find your information. Claiming is the way to go. If you did what I would have done, which was use a search for your own organization while we were talking about searching, if you saw that your program didn't pop up, you can add it. We actually rely on our community to help keep our listings as strong as possible, as robust as possible. And so the second link that I added here is a program to suggest, a link to suggest a program. So if you see that one of your programs is missing or a program that you know and love and work with is missing, fill out a suggest a program form that goes straight to our data team, those real people that are reviewing and vetting information. I'm going to pull up my screen to talk through referrals a little bit more deeply because it sounds like there were also some questions about keeping referral statuses and closing that loop, which I know was also a theme that came up in our challenges discussion. Is I don't want to send something into the abyss. I want to make sure that when somebody I'm helping reaches out for assistance, that they know whether or not they're getting help. I'm going to go ahead and share my screen. So Emil pressed send on a referral just a minute ago. 3 things happened when that referral got sent. Number one, the person we were helping got a notification, either by email or by text, that said, hey, someone is helping you. This is the organization they're sending you to. This is the contact information. Here's a phone number, here's an address, whatever information is important. The organization that is helping your client also gets an email, and this is what it looks like. So if I work for a program and someone is referred to my program, I get a notification in my email, hey, someone is reaching out for help, please contact them so that we can offer them the assistance they need. Here I'm able to track what's going on with the referral. I'm going to show you sort of all the different pieces around referrals for folks who said they wanted to be in that partner category. I will go ahead and just show y'all we had a good shift here, a good pretty wide range of where folks fell today. So for folks who saw themselves in that searching category, we talked through ways that you can look for great resources, save them, share them, print them, whatever the best way is to actually just get that information to your client. For the engaged group, everything we just talked about claiming your program, editing your information, that's really how you can make sure people know about your work. I'm going to take us into our third category, which is partners. So diving into managing your team and your listings, exploring your analytics, understanding referral tools. This is where we're getting into the advanced features. And so know that everything we're going to talk about right now is a great introduction. You do not need to leave this time feeling like you're an expert on everything. And we are more than happy to follow up with y'all and have continued conversation about what works for you in your organization. Okay, so I have come back to ConnectATX. I have logged in. I got that referral for Sam Seeker, who needed my help. I got my email notification. I knew I wanted to go check out what's going on with Sam, be able to respond to his referral. So here, I have a section called Inbound Referrals. And this allows me to examine all of those inbound referrals, everybody who's reaching out for help right now. This first one that we just looked at, that email for Sam, is what we call a one-step referral. One step because it's pretty simple and pretty easy. It's just gathering a little bit of information. The person's name, the best way to get in contact with them, and who's referring them. And that's it. So in this case, you can see that same referral that we were just looking at in the email. I can see that Sam reached out for help, prefers email, referred by Elaine here. And I can see a comment that Elaine left, something like, speaks Arabic. This is also a great place to drop in things like, make sure to call during a certain time window because that's when they're off work, or anything else that can be helpful to close that loop, extra context that would assist the receiving organization to better help your client. You'll see here that we have all of these green and gray buttons that show what happened when these people reached out. So all of these referrals came in and we were able to update the status. We reached out to Mason. He got help. Check. Got help. We reached out to Sandra. Sandra, we're still waiting, so we marked it as pending. We get to choose from this menu about which status is right for this particular referral and this particular client. And then when we change it here, everybody else knows the status. So if I change the status here on Mason to couldn't contact, Mason knows that we tried to reach him and we couldn't get to him. And Charles, who was helping him, also knows that we tried to reach him and we couldn't get him. Suddenly, that creates the opportunity for Charles to have a follow-up conversation with Mason or call us and really help address any barriers that are preventing Mason from getting the help he needs in this particular case. Multiple people to help triage these referrals. Yes, great question. So this was the first basic referral. This is just basic information, one step, contact info, how to reach out to that individual. On this dashboard, you can also filter to show you, maybe referrals that haven't been updated yet. You want to just make sure you haven't missed anybody. There's a new feature here as well. If you work in a situation where people are actually walking through your door or calling you to get into your intake process, you can manually add them to your dashboard and say, oh, I just got off the phone with so-and-so, I'm going to add them here, and make sure that they get into that loop so that they continue to be in that follow-up cycle with all of your other clients. Some of you may be thinking, this is great, but actually I have some more eligibility requirements. There are some other things that I need to make sure I know before I reach out. We have maybe some strict guidelines about who we can and can't help. Maybe we only serve veterans or families with small children. This is where a tool we call the screener could be a good fit for you. So I'm moving over to the screener section. You'll see that the dashboard looks pretty identical to what we just saw. So we have those same green and red and gray status updates. We've still got basic contact information for each individual, but there's a new column here that's called forms. And something that's really cool here is it's showing me right away, someone may be eligible or may not be eligible for my program. So if you have eligibility requirements, you can set it up to help divert people immediately to make sure they either are or are not able to get help in a timely manner. For this particular tool, you can actually set up the message that each person would get. So Charles, in this case, is going to get a message that says, you might not be a fit for our program. Here are some other resources we recommend to start your search over here because we don't think we're going to be able to help you. Whereas Sam got a message that said, you're likely eligible for our program. Someone will follow up with you in the next 48 hours. And that extra message, that extra confirmation right away that either you're on the right track or you're going to need to look somewhere else can help people in that moment of reaching out to know, okay, I have a plan, I have a next step to move forward. These screeners can ask all sorts of information, whether you want to ask many questions or just one or two. It allows you to just gather a little extra info about people who are reaching out for help, and it's totally customizable. So you get to set it up for your program, whatever makes sense for you. Great. The final tool I'll talk about is a scheduler tool.
Meredith,
For some of you, yeah.
just a real quick question. If an org is on the site as a resource, does that mean it already has a partner login to ConnectATX?
Great question. I am going to show you a little trick to help know if somebody from your team has ever logged in to ConnectATX or another Aunt Bertha powered site. And if they're already, maybe somebody on your team managing this. I will also say there's no such thing as too many claimers. We encourage folks to double, triple, quadruple claim their programs, have many people on your staff who are claimers. And that way, if someone is out of the office or leaves the organization, you don't lose access to folks who are reaching out to you or the ability to edit this program listing. You don't have to try to find that information later. So here, something that we noticed on our program cards, some of these program cards have a little blue check mark in the top right-hand corner. This means that the program is claimed. So what we talked about earlier, someone has said, I work here, I verify this, I'm going to keep up to date on it, I'm going to reach out. If your program card has a little blue check mark, someone, somewhere, at some point in time on your team has claimed the program. Again, if that has happened, wonderful. You're welcome to coordinate with your staff to figure out who did that and how to get in touch with that account. If it's missing, go ahead and claim it right now and make sure that you are able to edit that information, decide how people get in touch with you, and really keep your listing current for the people who are looking for your help. Finally, if that blue check mark is there and you also want to claim it, you can double claim it. Another great, quick, easy way to do that, if you are on, you can click on a particular program. At the bottom of each program, it says, work here, manage your listings. Clicking on that will link your account and help make that process even quicker. Claiming, I will mention, is a prerequisite for all of these tools we're talking about. So just to be able to edit your program listing, set up an intake tool, explore some of the other tools I'm about to go into, all of that requires you to claim. All you need to claim is an account. And something that I'll emphasize, absolutely everything that we are talking about today is 100% free for you to use. None of these tools have a cost to them. The only step you have to take is making a free account. I know that's a question that I often get, so wanted to address that one right now. So again, the last tool I wanted to cover, we talked about one-step referrals where you get basic information. We talked about screeners where you are able to gather some extra info and determine eligibility. If you're an organization that has a pretty robust intake system already, maybe people always have a meeting with one of your case managers, and it's best for them to just schedule time, do the introductory interview, and get on the calendar. You have the ability to set up a scheduler tool that manages that calendar on your program card as well, and allows people to book time directly with your staff. And so here, we're able to set availability. I can look at next week's calendar. Oh my gosh, there's no appointments available. I'm available on Monday. I'm gonna make sure that there are some extra appointments there. I'm available for 30-minute intake appointments. I'm gonna call them an intake appointment. I want 10 minutes in between. Voila, there are now a number of appointments for people to book directly through the site and to get in touch with our team and be able to get notified. We reviewed how to edit your program listings, but this is where you can select from those various tools. And so Emil already took us through this, but if you are interested in picking one of these tools, you'll head to edit program listings, you'll edit contact settings, and you'll be able to select from the drop-down menu. So I can choose one-step referral, screener form, scheduler. I can also say that people can't make contact, or I can link to something else that we already have. Whatever's the right process for you and your team, we want to make sure people get the right information to the easiest way to get in touch with you and get into your intake process the right way. This is an example of what that screener form looks like. So this was set up on our back end. You can see we were able to edit all of the questions and determine some eligibility questions that help us sort through potential applicants. There was a question earlier, I believe from Amy, about adding multiple people to help triage. You will notice there's about 7 different email addresses on this particular program. You can have as many people as you want notified about an incoming referral. The big thing I would recommend is working with your team to determine how you will do that triaging. So whoever gets it first, are you logging on and changing the status to pending so that somebody knows that that person is getting help? Are you making a phone call and then clicking this or changing this? Coming up with that process for your team is a real part of making sure that the system works for you. And so if you're going to have lots of different people getting that email, I would just encourage you to take that second step of figuring out how that triage will work amongst your staff. There's one more great feature I want to show you that comes with claiming your program, whether or not you choose to turn on an intake tool. But I want to pause here, see what other questions have come up about referrals, managing referrals, setting up intake tools, or just managing your program on ConnectATX. With that, I will take us to the My Team page. I know this is rarely work you do alone. And so whether you are working with volunteers or board members or a great staff who is on your team, My Team allows you to add other people to be a part of this work as well. So all those other people who you want to help triage those referrals, you're going to invite them up here, and you are going to, make sure that their first name is here and add their email. You're going to give them access to various things. You're going to send that invite, and they're going to be able to do all the things you can do, edit that program listing, manage inbound referrals. The only difference I will emphasize here, you can select from admin or worker. An admin can add other people, a worker cannot. That is the only difference between those two roles. And if you accidentally give somebody the wrong role, you can always change it. So down here, you're able to edit everybody's role. You can deactivate folks who should no longer have access, and really make sure that you're keeping up to date on who has access to your listing. The great thing about Teams, you can see all of the referrals together. You can also share things like your favorites folders and the people you're helping. You're all able to see all of the people you're helping together. You're all able to see some of your favorite programs that you refer to all the time. And it really creates that hub for you and your team to collaboratively support your clients. I know it's the end of the year. I know we are all thinking about fundraising right now. One thing that I will just plug here is our free analytics dashboards that come as part of claiming your program. These dashboards allow you to see things like who is reaching out to your program, who's clicking on your program, where are they searching from, what other resources are they searching for. You can see the geography of where people come. There's great tables and graphs, and all of this can be downloaded to be put in an annual report or a fundraising letter or a grant report that you may have to share back. So here I can see how many times my program has popped up in search results. I can see how people are interacting with our listing and how many referrals we have outstanding. I can see when we're seeing big bumps and what kind of actions people are taking, where in the country they're searching from. And as you zoom in, you can get down to the zip code level. Things like referrals, who got help, who didn't, where did those referrals come from? And I get all of this contact info about each referral. Again, all of this I can download. So if I need to be able to share this spreadsheet quickly with someone else, either on my team or a partner, I can download it, manage it in a spreadsheet, manage it in Excel, and share it out. So we've talked about intake tools, we've talked about managing your program, we've talked about teams, analytics, talked about searching for programs. This is a lot of information. I want to see what questions have come up before I move to our final category.
Yeah, so can you go over one time really quickly how I would see referrals to my organization in the ConnectATX platform?
Yeah, so if you head to, I will give you this sort of shortcut link. You can head to regular ConnectATX and get there, or if you go to the ConnectATX, uwatx.org, that will take you to the page that allows you to log in at the top. If you have logged in and created an account, so right now I'm logged in, you can see my name and my initials at the top. If my account is connected to my program because I have claimed my program, I will have this My Program Tools menu up at the top. When I go to My Program Tools, I go to Inbound Referrals. And so if you have a referral tool set up, this is where you'll be able to keep track of those. Referrals never get deleted, so you will see any referral that has ever come in. If you don't yet have a referral tool turned on, you obviously won't have anything in your dashboard, but logging in and then heading to My Program Tools, Inbound Referrals is where you can see that information. And if that's something you should have access to and don't yet, then we can work to make sure that your account is set up and claimed connected to your program. I feel like I interrupted you at the end, so I want to make sure I fully answered your question.
Yes, yeah.
Wonderful. Okay. The final category we're going to move into, we have talked about being a searcher or engaged or partner. We want to talk about being a champion because this is systemic work. This is a type of work where we're trying to bring more people to the table. So I want to talk about ways that you can continue to be involved in model community and again, help widen this network, bring more people in. So I'm going to head to one of our partners. The Austin Diaper Bank. They have selected a champion tool called the Simple Search Box. And we know that folks come to the Austin Diaper Bank website all the time, that this is a really important resource in our community. They're already coming to look for help. And so they're coming here to find diapers. And as they're scrolling down, right here in the middle of their page is a search box. And this is a window or a door right into ConnectATX. And so from the Austin Diaper Bank website, an organization I know and trust and I'm already going to for help, I can begin my search in my zip code and it's going to take me back to ConnectATX. And so if you have a website where people are already coming to you for help, where you're already offering resources to your community, this is a great tool that you can add on. And notice it's taken me right back to ConnectATX. I'm able to explore all those same categories we were looking at earlier. and I'm able to access all of my tools again because I'm logged in up here at the top. This is one way that you can stay involved and a great, just easy tool that you can add. But know that we really want to know more about you and your work and how you hope to be involved, and maybe how this site can even work better for you and people you're trying to serve. This is the beginning of a conversation, not the end. And so with that, I want to bring us into some possible next steps, things that you can do to be a part of this wider model community work coming up, and then offer us a chance to close out or continue some small group conversations as makes sense for your schedule. So we asked you this a couple of different times, and we've used this chart throughout to talk about the way that you show up in this work. And you may have found yourself wanting to play many different roles. So for each role, there's at least one great next step you can take to deeply engage with this work, bring more people to the table. For our searchers, if you are someone who wants to look for resources, help yourself, help other people, make those connections, the best thing you can do is make an account. If you don't have one already, in the top right-hand corner, you click sign up, use your email, make up a password, and you're done. Having that account allows you to track referrals, save favorites, and really just get the most out of your searching on the platform. One thing we did not touch on too much is the amazing ConnectATX help form or survey. You heard Jeff mention the term SDOH, or social determinants of health. This is a really cool feature that the United Way team has built into their platform that lets people take a quiz to find out what resources they need. And as you take the survey, you get personalized results that pop up based on what you selected. This is a really great feature to share with clients directly. They can fill it out themselves, get recommendations, and be able to connect directly to those programs. If a program that you know and love, or one you work with closely, is missing, again, I added that suggest a program link earlier. Please help us keep this database vibrant and robust. You will know the great, small, new, wonderful programs that our team may have missed. And we do rely on the support of our community to help keep this database accurate. For those of you who are like, great, I did all the searching, but what I want is that engagement. I want to be able to claim my program. I want people to know about our work. Claiming your program, again, is that next best step. That gets you the My Program Tools menu and that little blue check mark. And so for our engaged folks, claiming your program is the best thing you can do right now. If you've already claimed your program, you're ready to think about that deeper partnership. You want to figure out what role you play in a closed loop referral system. You are going to pick one of those intake tools. You are going to work with Emil and myself to figure out the right path for your organization, the right way for people to get in touch with you. And we'll help you get that set up on your program so that you're able to connect directly to people through the site and keep them up to date on their status when they reach out for help. Finally, for our champions, we've got simple search boxes, we've got postcards, we've got one-pagers, we've got all sorts of things that you can have that can just help bring brand awareness to the site, make sure people know that this is a free resource that they can access that is targeted towards our Austin community. We also really want to invite y'all to help shape this wider conversation and bring more people to the table, share your feedback. This is an iterative process, and we are always trying to make this site even more user-friendly and even better for the people doing the serving, offering the programs, and for the people who are looking for help. So we've got lots of opportunities for further partnership. These are things we would love to talk to you about. And on that front, here is Emil and my contact information. We are the best people for you to talk to about moving forward on this platform in any way. And would love to set up some one-on-one time, answer questions, and figure out the right fit for your organization. With that, I'm gonna pause for questions. We will share the PowerPoint. Great question, Sierra.
Hey, Meredith, before we go any further, I just wanted to say also, you brought up a point about community feedback. And so one of the things that we have received is that the user experience can be improved with the front page of ConnectATX. And so we just wanted to let you know as we move into 2021 that our front page is going to be changing, and that we've taken a lot of that feedback and are going to be putting it to practice. And so we're going to be utilizing tools that Aunt Bertha offers, such as like custom filters. We're going to be really personalizing it so we can get better as far as like the categories that are available and the subcategories in there, just based off research and feedback we've gotten from the community. And so, you know, like a filter, like you might be working with someone who, you know, may be undocumented, and you want to search for resources that serve that population. We'll have like a filter that you can click on, and it'll bring up resources for that, you know, that serve that population. And so, and that's all feedback, great feedback that we got from the community. And we hope to have those changes live in early 2021, probably first quarter of 2021. So we're really excited about that. The other thing that we're working on that has been a request from the community for years is, oh my gosh, wouldn't it be great if 211 had text? And oh, we're right there with you, but it's a state platform and the state makes the call on that, but we don't have to wait that with ConnectATX. And so in 2021, we will be offering the services through text, which we're really excited about. I can't give you a firm date on that or anything because we're still working on the technology piece of that. But yes, we will have that available for the community in 2021. So we're super excited for that. And then I think I said that we're expanding out to Williamson and Hayes County as well in 2021. And I know I'm not going to put Meredith on the spot anyway, but we know that they're working on some really cool technologies on their front that are going to be on our platform at some point. And so we're definitely not, you know, we're not definitely living in the status quo. We're really excited to be moving this tool forward with their partnership. So thank you, everyone.
Thanks for that, Jeff. That is wonderful context. And as I said in the chat, I mean, I work with a number of our partners across the state. I work with our community-based organizations across the state of Texas, and United Way is an incredible partner in this to really make sure that our site for our community, connecting Austin, Texas, ATX, it really does meet our needs for our community, for the people we're serving. And that's pretty powerful. So I want to open it up to any final questions, and then we're going to offer the space for continued conversation and questions if y'all want to stick around, and also know that December is a busy month. And so if folks need to drop off, we appreciate your time here today.
I also just want to confirm a few things. We're going to send a follow-up email that will have the PowerPoint, some links that were shared in chat, contact information, and such like that. We also are sharing a link to an evaluation about this event itself. We'd love your feedback on, is this helpful? What kinds of engagements? We know pandemic fatigue and Zoom fatigue are very real, so we are here for any feedback you have about sessions like these, and we'll include that in the follow-up as well. So again, that's in the chat, and then we'll send an email out afterwards as well. And I'm going to stop the recording.